Hi, Sarah. Thanks so much for coming to talk to us today. We really appreciate how busy you are. So it's great that you could spare us a few minutes of your time. We've had lots of inquiries recently, as you can imagine, from people with MS to our inquiry line. And I think to have your input onto helping us answer some of those questions would be really helpful. Perhaps you could just start by introducing yourself.
Yes, hello everyone. My name's Sarah White and I am one of the MS nurses at St George's Hospital in London.
Great, thank you. So as you can imagine, one of the main concerns that people with MS have, they know that you as MS nurses and the neurologists and the physios, etc., are all being redeployed and having to work in other areas or cover services with short staff. So if you could explain a little bit about what's happening to MS services around the country during the outbreak, that would be really helpful.
So lots of MS nurses and neurologists and support staff have been redeployed to help out with the COVID-19 pandemic. However, MS services are trying to still run, and therefore if you need to contact the service, go ahead in your usual way. There should be advice either by telephone on their message or by email explaining how to get in contact with the service. Just bear in mind that it may take longer for people to get back to you because the services are running on less staff than usual.
So what's happening for people who've got a routine appointment?
Many services are cancelling routine appointments or postponing them to a later date, and the team should be contacting you to let you know of that. If you haven't heard from the team, then I suggest that you try and contact them before going to the hospital, as most routine appointments have been postponed. If you are due an infusion and you've not heard from the team, I would do the same. I would contact the service and find out if it is taking place, if it has been postponed, and also whereabouts in the hospital you will be being treated, because again, the location may have changed.
Okay, no, that's a really good point. Thank you. People with MS are obviously still going to experience problems with their MS that may be urgent, and if they can't get hold of their MS team, what should they do then?
So I would still suggest to phone the team or email, whatever you usually do. And as I said, you will be guided as to who to contact. If you have symptoms suggestive of a relapse or you have symptoms that you're worried about, then leave a message and hopefully someone will get back to you. Services are still trying to manage the relapse part of the service and attend to urgent queries. If someone can't get hold of their MS team, I suggest they phone their GP or NHS 111 and someone will be able to help them. If, of course, they have life-threatening symptoms, so they have difficulty breathing or they have chest pain, then they would need to go to A&E in the normal way.
As always, there's lots people can do to help themselves stay well, but that's more important than ever right now. So what advice would you give people in that respect?
I'd advise people to make sure they're having a healthy, well-balanced diet, that they're taking regular exercise within their means, whatever they can usually manage, and that they try and stay connected with their friends and family because they can also offer them support.
So we've had quite a few inquiries at the MS Trust from people with MS who think that they should have had a letter advising them to shield, which is obviously more than just the lockdown that we're all going through, but they haven't heard anything yet. What would you advise those people to do?
So it's important to emphasise first that just having MS does not in itself increase your risk of getting COVID-19. However, there are many people with MS that will fall into the category of either needing to self-isolate or to shield. And the MS team should have made contact with you to explain whether you need to self-isolate or shield. If you need to shield, then you should also expect to receive a letter, although not all those letters have been sent out yet. If you haven't received a letter and you think you should have done, then I suggest you contact your MS team for advice about whether you need to self-isolate or whether you need to shield. And which category you fall into depends on a number of factors, and the MS team will be able to give you advice about that.